Hello.
Yes, Dr. Fawwaz. Just speak up a little.
Hello. Sir, can you hear me now?
Yeah, we can hear you, but just speak up a little.
Hello. Is it better now?
Yes, it is. So we'll just wait for another 2 minutes, and I'll then do a brief introduction, and then you can start.
Okay, sir.
So I think we can start. We're still waiting for Dr. Azam to join, and I think he can join in the middle. So I welcome you all to Residence Corner module. These sessions are arranged by Department of Neurosurgery at Liaquat National Hospital. The idea behind these sessions are to build to build an idea about 3D neuroanatomy, which is very important while doing neurosurgery. Our presenter today is Dr. Fawwaz Bin Shahab. Dr. Fawwaz is fourth year resident in Department of Neurosurgery at Liaquat National Hospital, and he'll be discussing anatomy of internal carotid artery. Our expert panelist today, who will join shortly, is Professor Azam Ahmed, who is associate professor of neurosurgery at University of Wisconsin. I urge you all to participate when questions are asked. There's no harm in being wrong. These sessions are for you. Dr. Fawaz, can you start?
Yes, sir. So can you
Try and
hear me?
speak up. Try and speak up now. You're not audible. You're just on a low tone.
Hello. Is it now clear?
It's better, but you can, if you speak up, it will be much better. Yeah.
Okay. So our today's topic of the neuroanatomy session is on the internal carotid artery. So when we start with the internal carotid artery, we all know that it's a branch of the common carotid artery where it divides into two, the internal carotid and the external carotid. Today we'll be dealing with the internal carotid and its segments. So if we divide the internal carotid artery into these segments, we have 7 basic segments that are colored in different colors. The initial or the first segment is the cervical segment, where it passes within the cervical region or the neck region. And then the internal carotid artery passes into the petrous temporal bone, where it is called the petrous segment of the ICA, followed by a very short segment which is overlying the foramen lacerum, so it's called the lacerum segment. Then it courses intracranially within the cavernous sinus, and there it has a few significant turns that we'll be dealing with. This is called the cavernous segment of the internal carotid artery. Just as it pierces the roof of the cavernous sinus, it passes adjacent to the medial aspect of the clinoid process, the anterior clinoid process, where it is termed as the clinoidal segment of the ICA. Followed by the clinoidal segment, we have the supraclinoidal segments, which are superior to the clinoid, which includes the ophthalmic segment, followed by the communicating segment. And then the ICA divides into its two major terminal arteries, which is the MCA and the ACA. So if we revise it superficially, we have the cervical, petrous, lacerum, cavernous, clinoidal, and then the supraclinoidal comprising of the ophthalmic and the communicating segments. We'll be dealing with each of these segments separately, and we'll be discussing the branches that each of the segment gives rise to. So another diagram showing you a basic orientation of the similar picture. You have the following parts along with the following branches that comes of those. The cervical part, which is within the cervical region, it gives off no significant branches, followed by the petrosal part, which gives off two branches. If we consider it superficially along the anatomic territory where it passes through, you can appreciate that it gives off the uh, caroticotympanic artery, which is towards the middle ear cavity, and it also gives rise to the artery of the pterygoid canal. Then if we progress further, after the petrosal part, you have the, if you see here, you have a short segment or the lacerum part and followed by the cavernous part. So on and off, the lacerum part is a very short part and it's not being discussed in detail. But if we see here, this is the cavernous part. The cavernous part gives of the following branches that we'll also be dealing separately. For example, it gives off the tentorial branches, the basal and the marginal. It also gives off a branch which goes to the pituitary region, the inferior hypophyseal artery. It gives off a trigeminal ganglion branch. It gives off a cavernous sinus branch and a meningeal branch. Followed by this, you have the, now this was the cavernous segment. Then you have the clinoidal segment and the supraclinoidal segment. The supraclinoidal give rise segments basically includes the ophthalmic and the communicating segments. And then it gives off the ophthalmic artery from the ophthalmic segment, followed by the anterior choroidal artery. And from the ophthalmic segment, you also have a significant branch, which is the superior hypophyseal artery. So this is just a basic overview. We'll be discussing all those branches separately so that we can remember those. This is again just a simple diagram showing you the common carotid being divided into the external carotid and the internal carotid. And then you have the following segments: the C1, which is the cervical segment, C2, which is the petrosal segment, C3, which overlies the foramen lacerum, which is the lacerum segment, then C4 segment, which is called the cavernous segment, which lies within the cavernous sinus, then C5, which is the clinoidal segment, and then it divides into the C6, C7, which is the supraclinoidal segments, the ophthalmic and the communicating segment, and then it terminates into the ACA and the MCA. So if we read it in the text, the ICA is divided into the following parts: the C1 or cervical portion extending from the junction of the common carotid artery, the C2 or the petrous portion, which courses within the petrous temporal bone, the carotid canal, and it ends where the artery enters the cavernous sinus. The C3 is the lacerum part, C4 or the cavernous portion, which courses within the cavernous sinus, and this ends where the artery passes through the dura mater that forms the roof of the cavernous sinus. The C5 or the supraclinoidal portion begins where the artery enters the subarachnoid space and it terminates at the bifurcation into ACA and MCA. So again, just to remember these parts, you have cervical, petrous, lacerum, cavernous, clinoidal, and then the supraclinoidal segment comprising the ophthalmic and communicating artery. So now we'll be dealing with each of the parts separately along with their pictorial representations. So the C1, which is the cervical part, it begins in the neck at the carotid bifurcation, where the common carotid artery divides into ICA and ECA, the internal and the external carotid arteries. The cervical part is encircled with the postganglionic sympathetic nerve fibers, and the internal carotid artery travels within the carotid sheath accompanied with the internal jugular vein and the vagus nerve. So the C1 portion would end where the ICA enters the carotid canal of the petrous bone. The cervical portion has no significant branches. However, it is accompanied by the hypoglossal and the glossopharyngeal nerve that crosses it, and the vagus nerve, which continues to follow it within the carotid sheath. So this is the cervical course of the ICA, the common carotid dividing into the external carotid and the internal carotid running along the jugular vein and the vagus nerve within the carotid sheath. It is being crossed by the hypoglossal and the accessory nerves, whereas the vagus nerve follows it along its course. The next part, which is the C2 or the petrous part, is still being surrounded by the postganglionic parasympathetic sympathetic nerve fibers. The C2 part starts where the cervical part of the carotid artery enters into the petrous temporal bone, and this petrous part ends at the posterior edge of the foramen lacerum, which is just inferomedial to the edge of the Gesserian ganglion in the Meckel's cave. So the C2 or the petrous part begins at the uh, temporal bone, where the cervical part enters into the petrous temporal bone, and it ends at the foramen lacerum level. So it has basically three subdivisions. It has a vertical segment, it has a posterior loop, and it has a horizontal segment. The petrous part has a vertical segment when the ICA is ascending into it, and then as it bends, it becomes the posterior loop, which is anterior to the cochlea. And then it has a horizontal segment, the deep and it is deep and medial to the greater and lesser superficial petrosal nerves, and it is anterior to the tympanic membrane. We'll be seeing this diagrammatically. So this is the petrous temporal bone, the yellow colored or the shaded region, and within the petrous temporal bone, you can see this highlighted or a dark red colored portion, which is the petrous temporal bone, which has specific turns. For example, if you follow this course, it can be it as it initially ascends into the petrous temporal bone, it has a vertical segment, and then it has a posterior loop, and then followed by the horizontal segment. So these are all turns within the petrous temporal bone, where the petrous part of the carotid artery passes through. It is accompanied by the internal jugular vein here. As we can see some other structures within this picture, for example, this is the petrous segment of the petrous part of the ICA. Associated structures within this region of the petrous temporal bone, as highlighted in yellow color and also highlighted with the black colored arrow. This is the eustachian tube. This dark blue colored structure is the internal jugular vein. So this is again an other view from the anterior aspect. This is showing you the dark red colored structure, which is the petrous segment of the internal carotid artery. The petrous segment is also related on its superior aspect to the trigeminal nerve, along with the ganglion of the trigeminal nerve sitting within the Meckel's cave. So this green colored structure is the ostium of the Meckel's cave for the trigeminal ganglion. And this nerve, which has been cut through, is the trigeminal nerve. This is passing over the petrous part of the carotid artery. This is again a superior view of the petrosal segment with much details. The vessel is passing downward below the trigeminal nerve, and this is the trigeminal nerve with its divisions. Now, followed by the petrous segment, you have the other segment, which is the lacerum segment, which is basically a very small segment adjacent to the foramen lacerum. So in this picture, the trigeminal ganglion has been removed to better visualize the petrosal segment of the ICA within the carotid artery and the lacerum segment passing over the foramen lacerum. This segment ends at a specific ligament, which is called the petrolingual ligament that I'll highlight in the next diagram. This ligament, which you can see here, this is the petrolingual ligament, which attaches to the petrous temporal bone and to the dorsum celli. It marks the beginning of the cavernous segment of the ICA. Now here you can see the greater superficial and the deep petrosal veins are seen to join and become the Vidian nerve, which travels along the inferior lateral aspect of the sphenoid sinus. This dark red colored segment is the petrosal segment within the petrous temporal bone. This ligament that we already saw in the previous diagram, which has now been highlighted yellow, is the petrolingual ligament. This marks the extent of the petrous and the lacerum segment of the ICA, and basically the end of the petrosal segment and the beginning of the cavernous segment. So after this petrolingual ligament, you would have this segment that will be highlighted in the next picture. This is the cavernous segment, as shown here. So this was the petrolingual ligament. Proximal to this would be the petrosal segment, and distal to this would be the cavernous segment. Now, this petrosal segment is also related to a nerve that we already discussed, the greater superficial petrosal nerve and the Vidian nerve. This is again a schematic diagram. As we discussed up till now, C1 is the cervical part, then C2 is the petrosal part, where the internal carotid artery runs through the petrous temporal bone. This is followed by a short segment called the C3 or the lacerum part, where it is related to the foramen lacerum. And then this would be followed by the C4 or the cavernous part. Following this is the clinoid process, and here would be the C5, the clinoidal segment, and followed by that would be the supraclinoidal segment, the ophthalmic and the communicating segments. The C3 or the lacerum part, if we discuss it in theory, the ICA passes over the foramen lacerum, but not through it, forming the lateral loop. The lacerum part ascends in the canalicular portion of the foramen lacerum to the juxtacellular position. It pierces the dura as it passes the petrolingual ligament to become the cavernous segment. This we have already discussed diagrammatically. The branches are usually not visible angiographically, but the following branches are important as we discussed in the initial pictorial diagram. The caroticotympanic artery, which is an inconsistent branch for supplying the tympanic cavity, and the pterygoid or the Vidian branch, which passes through the foramen lacerum and is present in only 30%. It may continue as the artery of the pterygoid canal. So now coming into detail of the segment 4, the cavernous segment. We have done up till now the cervical segment, the petrosal segment, the lacerum, which is a small segment, and now the cavernous segment. The cavernous portion of the ICA begins at the distal end of the petrolingual ligament that we have seen in the previous diagram. Just distal to the petrolingual ligament, the artery enters the carotid groove of the sphenoid bone. It then turns vertically, then horizontally, and then inferiorly before turning vertically again. This segment is called the carotid siphon. It then enters the proximal dural ring, where the clinoidal segment of the carotid artery begins. So this is basically the overview of the cavernous segment. The cavernous segment begins at the region of the ligament that we already discussed. We can see it again in the diagram. This ligament, which is the petrolingual ligament, this marks the beginning of the cavernous segment, and the cavernous segment ends at the proximal dural ring, which marks the beginning of the clinoidal segment. And these are few of the turns that are important for the cavernous segment. It turns vertically, then horizontally, and then before it turns vertically again. This is the carotid siphon. So the cavernous segment is covered by a vascular membrane lining the sinus, and it is still surrounded by the postganglionic sympathetic nerves. It passes anteriorly, then superomedially, then bends posteriorly. This is the medial loop of the ICA. Then it travels horizontally, bends anteriorly. This is part of the anterior loop of the ICA, and this is in relation to the anterior clinoid process. And then as we have already discussed, it ends at the proximal dural ring. There are many branches of the cavernous segment. The important ones include the meningohypophyseal trunk, which is the largest and the most proximal branch, The other branches include those to the tentorium, which is also called the artery of Bernasconi and Casinari, which is the blood supply of petroclival meningiomas. Then we have dorsal meningeal arteries, which is also called dorsal clival artery, the branches of which include the inferior hypophyseal artery to supply the posterior lobe of the pituitary, the anterior meningeal artery, the artery to the inferior portion of the cavernous sinus, and the capsular artery of McConnell, which supplies the capsule of the pituitary. So these are few names to be remembered. The cavernous segment gives off many branches. Important ones include the meningohypophyseal trunk. The other branches are the artery of the tentorium, which is also called the artery of Bernasconi and Casinari, dorsal meningeal artery, which gives off the inferior hypophyseal anterior meningeal artery to the inferior portion of cavernous sinus, and the capsular artery of McConnell, which supplies the capsule of the pituitary. So this is just an endoscopic view picture representing the cavernous segment of the IC along with its various turns. Now, there are important relationships of the adjacent nerves. The cavernous sinus houses the cavernous segment of the ICA along with various nerves that are in relation. This is the oculomotor nerve passing through the lateral aspect of the cavernous segment of the ICA. This you can see is the trochlear nerve. This is the trigeminal nerve along with its three divisions, the ophthalmic, maxillary, and the mandibular. So this is also in relation to the cavernous segment of the IC. Now, this is the petrous sphenoidal ligament, which is also called the Gruber's ligament. It extends from the apex of the petrous bone up till the posterior clinoid process. And this forms the roof of a canal, which is called the Dorillo's canal, through which the abducent nerve passes. So this ligament, which is highlighted yellow, is the petrous sphenoidal ligament or the Gruber's ligament, and it houses a canal which gives pathway to the abducent nerve. We'll be seeing that again. This is the petrous apex, for instance, and this is the posterior clinoid process. This is the posterior clinoid process arising from the dorsum celli. And here you have the ligament from, and this forms a canal through which passes the abducent nerve. So this highlighted yellow colored structure is the abducent nerve within the canal, which is called the Dorillo's canal. So this is another pictorial representation. You could see here that this is the cavernous segment of the ICA, and here would be the clinoid process through which the ICA becomes the clinoidal and then followed by the supraclinoidal segment. The anterior clinoid process has been resected here. The clinoidal segment is medial to the anterior clinoid process. This is the picture showing you the cavernous segment of the ICA within the cavernous sinus, and then it turns medial to the anterior clinoid process to become the clinoidal segment followed by the supraclinoidal segment. So here are two dural rings, the proximal and the distal dural rings. This is the proximal dural ring and this is the distal dural ring. Between the two rings, the segment of the ICA is called the clinoidal segment, or it is also sometimes called the ringed segment of the ICA. And distal to this would be the supraclinoidal segment. So these are the specific terms that we were talking about. We'll be discussing them in theory as well. In the cavernous sinus, this goes anteriorly, then this turns posterior medially, and then again it turns superiorly. So these turns are important with respect to the angiographic orientation of the ICA and its segments. Then comes the clinoidal segment or the supraclinoidal portion of the ICA. The C5 or the clinoidal segment begins at the proximal dural ring. We also already saw in this diagram. It begins at the proximal dural ring and it ends at the distal dural ring, where the ICA then becomes intradural and supraclinoidal. So it emerges from the dura mater that forms the roof of the cavernous sinus, Then the ICA enters the cranial cavity by passing along the medial side of the anterior clinoid process and below the optic nerve. This we have already seen. Then it courses posterior, superior, and slightly lateral to reach the lateral side of the optic chiasm and bifurcates below the anterior perforated substance at the medial end of the sylvian fissure to give rise to the terminal branches ACA and MCA. Now, this was the thing we were talking about. When it is viewed from laterally, the cavernous segment, which is C4, and the intracranial C5 segment have several curves which form an S shape, and together these are called the carotid siphon. The lower half of the S, which is formed predominantly by the intracavernous segment, it is convex anteriorly, and the upper half, which is formed by the supraclinoid portion, is convex posteriorly. So if we see in this diagram, this half, which is formed by the cavernous segment, is convex anteriorly, whereas this half, which is formed by the supraclinoidal or the C5 segment, is convex posteriorly. So these two terms are important with respect to the angiography. The lower half formed by the intracavernous is convex anteriorly. The upper half formed by the supraclinoid is convex posteriorly. And the junction of these two convex segments passes along the medial side of the anterior clinoid process, which we have already seen in that diagram. And then the pre-bifurcation branches of the C5 are the ophthalmic, posterior communicating arteries, anterior choroidal artery, perforating, and superior hypophyseal. These are important branches. We'll be discussing them separately. So the segments of supraclinoidal ICA, it is divided into three segments based on the site of origin of the ophthalmic, PCOM, and anterior choroidal. The ophthalmic segment is the initial most segment. It extends from the roof of the cavernous sinus and the origin of the ophthalmic artery to the point of origin of the posterior communicating artery. The next segment is the communicating segment, which extends from the origin of the PCOM artery to the origin of the anterior choroidal. And the third is the choroidal segment, which begins from the origin of the anterior choroidal to the terminal bifurcation of ICA into ACA and MCA. So you have three segments: ophthalmic segment, communicating segment, and the choroidal segment. The ophthalmic segment is the longest. The communicating segment is the shortest. So now these three segments are important. We'll be discussing them separately. Ophthalmic segment, an average of 4 perforating arteries arise from the ophthalmic segment. Most arises from the posterior or the medial aspect. These branches are most commonly distributed to the infundibulum of the pituitary gland, the optic chiasm, and less commonly in the descending order of frequency to the optic nerve, premammillary portion of the floor of third ventricle and optic tract. A few vessels terminate in the dura covering the anterior clinoid process, sella, and the tuberculum sellae. The arteries that arise from this segment, which pass to the infundibulum of the pituitary, are called the superior hypophyseal arteries, which are important branches. Then the C7 or communicating segment. This begins just now. We already saw that there are three segments: the ophthalmic, communicating, and the choroidal. So we have done with the ophthalmic segment or the C6 segment, and the C7 segment, which is the communicating segment. It begins just proximal to the PCOM origin. It travels between the cranial nerve 2 and 3, and it terminates just below the anterior perforated substance, bifurcating into ACMCA. No perforators arise from the communicating segment in more than half of the hemispheres, and if they are present, only 1 to 3 are found. Few anterior thalamoperforators that may be present supplies the optic tract, chiasm, posterior hypothalamus. There are two segments: flexal segment, where it enters the temporal horn. Only this portion of the choroidal plexus is being formed by this, and the cisternal segment, where it passes through the crural cistern. Then we have the anterior choroidal artery. The anterior choroidal artery is an important branch. It takes off 2 to 4 mm distal to the PCOM, and it supplies portion of the optic tract, the medial globus pallidus, the genu of the internal capsule, inferior half of the posterior limb of internal capsule, uncus, the retrolenticular fibers, and the lateral geniculate body. Now, this is the branch that we were talking about. This is the ophthalmic artery, the ophthalmic segment. And this red colored structure is the is the superior hypophyseal artery, which is arising from the ophthalmic segment and supplying the superior aspect of the hypophysis or pituitary. Now, this red colored structure, which is arising from the inferior aspect of the pituitary and supplying the inferior aspect of the pituitary, is the inferior hypophyseal artery, and this arises from the cavernous segment of the ICA. So this was the cavernous segment, which then arises proximally to form the clinoidal segment. Then it becomes the ophthalmic segment. The ophthalmic segment gives off the superior hypophyseal artery, whereas this inferior hypophyseal artery, which is appreciated in this coronal view, is coming up from the cavernous segment. Now, this is another view of the similar picture. This is showing you the ICA with its various segments that we already discussed. This dark blue colored structure is the ophthalmic segment, followed by the communicating segment, followed by the choroidal segment, and then it divides into ACA and MCA. This green colored structure that is passing posteriorly is the anterior choroidal artery. And this blue colored structure that is passing posteriorly from the communicating segment is the posterior communicating artery. So these are two important branches, the PCOM artery coming from the communicating segment and the anterior choroidal artery coming from the choroidal segment. This is almost the same picture in a different view, showing you the segments of the supraclinoidal ICA, the ophthalmic, communicating, and the choroidal segment. This is the cavernous segment. The cavernous segment then progress. This is a small structure which is shown in yellow color, which is called the carotid collar. Between the proximal and the distal dural ring, the part of the dura that covers the internal carotid artery is the carotid collar. This then ascends proximally. We have already studied this is the ophthalmic segment, which has been highlighted dark and also labeled with an arrow. From that ophthalmic segment, this highlighted or red colored structure, which is passing anteriorly into the orbit, is the ophthalmic artery. So this was the basic about all the branches and the structures of the ICA. So we have 7 segments. From each of those segments arises various branches that we have studied. Now there are a few pictures from the NGO which can highlight these structures. This is the cervical part of the internal carotid artery. The cervical artery, this can also be a basic revision to what we studied. The cervical portion then becomes the petrosal portion, where the cervical part of the internal carotid artery passes into the petrous temporal bone. This is followed by a short segment, which is often not visible angiographically, the lacerum segment, followed by this turned segment, which is passing within the cavernous sinus, which is the cavernous segment, followed by the clinoidal and the supraclinoidal segments. The first and the most significant branch that passes anteriorly from this is the ophthalmic artery, and this would pass towards the orbit. 2 branches that passes posteriorly are the PCOM, the posterior communicating, and the anterior choroidal. The posterior communicating originates proximally, followed by the anterior choroidal artery. And then this is the ICA terminating into the 2 terminal branches, the ACA and the MCA. Now, there are a few important points that need to be discussed so that a PCOM artery can be differentiated from the anterior choroidal on an angiogram. The PCOM is usually proximal to the anterior choroidal that we already discussed. The PCOM is usually larger in its pores. The PCOM usually goes up or down a little, and then it moves straight back, and usually it bifurcates. Whereas the anterior choroidal usually has a superior hump that we discussed as the flexal point, where it passes into the choroidal fissure to enter the ventricle. So if we see these points here, the PCOM is usually proximal. The PCOM usually has a straight course, and then it bifurcates into 2 mostly. Whereas if we see anterior choroidal, it has a distal origin as compared to the PCOM. It has a hump, which can be seen here, where it enters into the temporal horn of the lateral ventricle at the flexal point. Okay, so this was the differentiation between the PCOM and the anterior choroidal. Again, in this diagram, you can see those clearly. From here, it would be the cervical part, then the petrosal part, then this is the cavernous segment, then the supraclinoidal segments giving rise to the ophthalmic artery anteriorly, the significant branch anteriorly, then its terminations into the AC and the MCA. On the posterior aspect, you can see the anterior choroidal with a hump, whereas the posterior communicating with a relevant or a significantly straighter course, and its termination or its bifurcation into two, which is a differentiating point from the anterior choroidal. This is another diagram of the angiography. This is the ICA portion, the cervical part. This is the first turn where it enters into the petrous temporal bone called the petrosal segment. Then you have the second important turn within the skull, which is the cavernous segment. Then it divides into two, the anterior cerebral and the middle cerebral. So we end up here with the basic discussion.
Thank you, Dr. Fawwaz, for the detailed presentation. Unfortunately, our expert panelist, Dr. Azam, had to scrub in an emergency case, but we'll be happy to take any questions if they are for the participants. Next week, we will be discussing the anatomy of anterior cerebral artery. If there are any questions, we'll be happy to take it. Otherwise, we'll end this session. Okay, thank you everyone for joining. I think there's so we've if you can see your chat box, we have uploaded a feedback form, and we'll be very glad if you can fill this. This will help us to improve this session. I will urge you all to just take few minutes and fill this form if possible. This will help you. This will help us and then help you. So please fill this form. We'll see you next week, where we'll be discussing the anterior cerebral artery. And I thank you all for joining.